Today's session looks at how nature-based solutions are one of the key answers to preventing zoonotic disease emergence. This session takes the format of a science talk and lecture, and we are thoroughly honored to welcome three outstanding experts. Dr. Neil Vora is a medical doctor and conservationist. He is executive director of the Preventing Pandemics at the Source Coalition and a former senior advisor for One Health at Conservation International. He was also a member of PREZODE Steering Committee. Dr. Paula Ribeiro Prist is a biologist and epidemiologist. She's a senior program coordinator for the Forest and Grasslands Unit in IUCN, International Union for Conservation of Nature, and a co-lead author of the IPBES Nexus report. Dr. Serge Morand is an ecologist and evolutionary biologist at the French National Center for Scientific Research, CNRS, and Kasetsart University in Thailand. He is also a principal investigator for Southeast Asia on the PREACTS ASAMCO program. Neil, I'll turn to you first. What lies behind the concept of nature-based solutions, particularly from a One Health perspective?
All right, thank you so much. It's an honor to be here. Really appreciate this opportunity. Let me just make sure that I'm getting my slide shared. One moment, please. Okay, and can I just get a thumbs up, Catherine, if you see the slides?
Yeah, that's fine, Neil.
Okay, good. All right, perfect. Huge honor to be here. Thank you all so much. Lots to get through, so I'm just gonna launch right into it. And these are some data that many of you have seen before. It's from Our World in Data, and basically looks at the last 200 years at a number of different metrics like poverty, basic education, literacy, and more. And it shows that across these different metrics, things are getting better for humans. For the average human today, it is actually the best decade to be alive compared to the entire hundreds of thousands of years of history of our species, right? Again, so for example, fewer people are living in extreme poverty today than 200 years ago. More people are vaccinated, fewer children are dying. These are all fantastic outcomes. But additional scientific research looking at processes that regulate the Earth's stability, known as planetary boundaries, show that we are now transgressing a number of different planetary boundaries. So these planetary boundaries include things like climate change and biosphere integrity and fresh water. And so in 2009, 7 of these boundaries were assessed and 3 were deemed to have been crossed. But last year, 16 years later, 9 of those boundaries have been assessed and 6 were deemed to have been crossed. And that, what this research shows, has major implications for the stability of the planet. Now, many indigenous and traditional cultures around the world have long believed that the well-being of humans is inextricably linked to the health of other animals and nature. And we are seeing a similar awareness now being incorporated in the public health sector under the mantles of One Health or planetary health. And since 2023, there's also been this growing movement on climate and health. I say 2023 because that was the year of the climate COP that took place in UAE, and that was the first time ever there was a dedicated climate and health day, and that climate and health movement has been taking off. Now, One Health, of all these different terms, some of them overlap with each other. Of all of these different terms, One Health in particular seems to be having the most traction in policy circles such as the WHO and CBD and the UN. And so you will find me in this presentation using the term One Health and planetary health, however, interchangeably. Now, more thought in this area has actually started linking the planetary boundaries that I introduced 2 slides ago, based on other people's research, to this planetary health model. And so this figure shows that connection, and it comes from a great paper published last year in The Lancet. But at the very left, you see these underlying drivers, things like our consumption patterns, and the authors talk about population size. And then they make the the connection to changes in Earth systems, particularly the planetary boundaries, and how some of these underlying drivers can lead to transgression of those planetary boundaries that in some cases can lead to tipping points for other bad events that affect things like air quality and fresh water and food. Then there are modifying factors like socioeconomic factors and wealth and race that at the end result in certain health outcomes, right? And that might be bad health outcomes like more nutritional disease or more infectious disease, which is the focus of today's conversation. So this fundamentally means, though, that there are actually two different takes on modernity here. Now, there's a fantastic book called The Wizard and the Prophet by Charles Mann, published a few years ago. And in that book, Mann describes two different camps with these different takes on modernity. One camp is called the wizards. And these are people whose worldview is that humans can overcome Earth's planetary boundaries and other limits. So they're optimistic about the future of technology for overcoming some of these challenges. But then Mann, that author, also talks about prophets. And these are people whose worldview says that humans cannot overcome Earth's planetary boundaries and other limits, that we have to live within Earth's boundaries. But this represents fundamental philosophical differences, right? Now I'm going to share with you some quotes that I think are representative of these two different camps. Now, the first quote that I'm going to share, actually, when I'm talking about these wizards in particular, I want to be very clear that the Alex Trembath and Mark Andreessen that I'm quoting here, I'm not trying to, I don't want to overinterpret what they're saying. I'm not trying to say that they necessarily deny the reality of climate science. I know that Alex Trembath actually firmly understands that the climate is changing, but his interpretation of the challenges that it poses for humanity is different than maybe many people on this call, because I think a lot of us on this call are already bought into the idea of One Health and planetary health. But let me read these quotes for you, right, from the wizards, from Alex Trembath. Limits to growth, the Earth's supposed human population carrying capacity, the 2-degree temperature target, the planetary boundaries, and the ecological footprint are not fixed biophysical constraints on human population and development, but rather arbitrary limits dressed up in the language of science intended to enforce a Malthusian scarcity agenda. And that Malthusian refers to Thomas Malthus, who in the late 1700s published that essay that basically said that human population growth is going to outpace the ability for the planet to produce food, and there would be mass starvation, which in fact has basically up until this point in time been shown not to be true, because there is enough food on this planet to feed 8+ billion people. It's just that the food is not equitably distributed. Now, Mark Andreessen, who is a very influential billionaire in the United States, a big supporter of President Trump, said this in what he calls the Techno-Optimist Manifesto. We are being lied to. We are told to denounce our birthright, our intelligence, our control over nature, our ability to build a better world. We are told to be miserable about the future. Now, I want to be very clear. I don't know if Alex Trembath and Mark Andreessen would identify as wizards. My interpretation of some of their work, though, suggests to me that they are in the wizard camp. Now, the prophet camp is different. These are people who believe that humans are a part of nature, not apart from nature. And as Whitney et al. Published in The Lancet back in 2015, they said that we have been mortgaging the health of future generations to realize economic and development gains in the present. So the reason I'm diving into this is to make the point that I think a lot of us, again, on this call today, subscribe to the One Health approach, believe in planetary health. But I want to be clear, we often only speak in our little echo chambers. We're only talking to each other, but we cannot assume that many influential people outside of our little group actually believe in the concepts of One Health, planetary health, and planetary boundaries. And these are people that are making massive decisions that affect the well-being of millions upon millions of people. So it is very important that we understand our philosophical differences. And that's why I want to dive a little bit deeper into the wizard camp, so that we understand their intellectual point of view. So I want to talk quickly about abundance and decoupling. Now, abundance is a movement that really took off last year, at least in the United States, after two authors, Ezra Klein and Derek Thompson, published this book called Abundance, but it has since then expanded well beyond that original scope that they proposed. And you even have Elon Musk, again, the first trillionaire ever in the world, who became a trillionaire just last week, who has had a major impact on US policy. And this is not just something that affects the United States, because Elon Musk was the one who is very much behind the dismantling of USAID that is going to lead to millions of deaths in the coming years. And he said recently, AI and robotics will bring up what might be termed the age of abundance. This is my prediction. It will be an age of abundance for everyone. And again, this is coming from a trillionaire who cut USAID. Now, there's this other conversation going on about decoupling. Hannah Ritchie, who is the lead research scientist at Our World in Data, said that living well does not need to come at a high cost for the climate. Economic growth and emissions reductions are often framed as being incompatible, but countries are proving that they can be. Or Dean Spears and Michael Garuso in their book After the Spike said, can the world decouple population and prosperity from air and water pollution? It has. From greenhouse gas, it can. And actually, there are data to support this decoupling idea. If you look, for example, at the UK, GDP is going up, whereas emissions per capita are going down. So this has been described as the environmental Kuznets curve. So what you see on the x-axis is GDP per capita, and on the y-axis is the level of environmental degradation. And so what these people in the wizard camp would argue is that as GDP per capita, right, which is economic growth, increases, you have more and more environmental degradation, but then there's this tipping point, and actually, as economic growth continues, the level of environmental degradation declines. Now, I'm not saying that this is something that I necessarily believe in. Actually, what my opinion is that wizards fundamentally misunderstand nature, but it's not just them. For wizards, as far as I can tell, based on my reading on their view, their only environmental concern that they ever consistently confront is on carbon dioxide emissions, carbon emissions, but not species extinction. But meanwhile, we are in the midst of a mass extinction event. Also, the growing climate and health movement. Actually, my view is that they actually are overlooking nature, as colleagues and I have written about in the Lancet and Stat News before. And even the climate sector largely overlooks nature, because over 30% of emissions reduction needed to reach our climate goals come from nature, yet nature receives less than 5% of overall climate funding. The point that my reading of the evidence is that there is actually no future for humanity without nature. Every material item that we need for our survival comes from nature. That's food, that's water, air, that they all ultimately come from nature. And all too often we assume, as Peter Frankopan has said before, we assume technology can endlessly override natural limits, but we have to accept that living within ecological boundaries is not optional. And zoonotic diseases are case in point, because they are showing how our broken relationship to nature is leading to more outbreaks, epidemics, and pandemics, as my colleagues will say more about today. And as we're seeing in the Congo right now, or as we recently saw with hantavirus, right, we are seeing more and more of these zoonotic disease outbreaks because of our own doing. We are doing this to ourselves. Now, nature-based solutions, which are defined as actions that protect, conserve, restore, sustainably use, and manage natural or modified ecosystems to deliver societal benefits, are a key part of our solution. And colleagues and I published this table in the Lancet a few years ago, but it looks at a number of nature-based solutions, whether it's forest protection or mangrove protection, or creating. The table describes the climate mitigation benefits, the climate adaptation benefits, and the additional health benefits. So I'm coming to my last few slides, right? I have two calls of action for everyone today. The first is that I want to be very clear. I think the path forward is somewhere in between, in the middle, between the wizards camp and the prophets camp. We need technology, but we also have to acknowledge that there are limits to growth. And we shouldn't be extreme on either end. but all of us should commit that we want to keep having more and more gains in development and human progress that have been experienced around the world. We need more of that because the job is not yet done, but the current trajectory is unsustainable. In so many policy circles, what gets measured matters, and that's the call to action. We need to make the case using data for greater investment in NBS. Because right now we do not have enough data to show that nature is critical for improving human well-being. That means understanding in the first direction of investigation how when we violate planetary boundaries, it leads to bad health outcomes like death. We also need to do the flip side. We need to investigate how investing in nature through nature-based solutions leads to better health. So two directions of investigations need to be pursued. And my final call to action on my last slide is also to remember, despite what I said a moment ago, not everything that can be measured matters, and not everything that matters can be measured. So many of us on this call today are scientists, healthcare professionals, public health workers. Facts are the currency of our work, but we have to also acknowledge that they alone cannot solve the catastrophic threats facing the world today. That will also take a radical reimagination of our future inspired by art and philosophy to catalyze the societal transformation that is desperately needed. So we must go out of our comfort zone to build new partnerships and engage communities and other beings that we are trying to serve. And with that, I will end. Thank you so much.
Thank you, Neil, for this clear and impactful introduction, and for reminding us that this awareness is not new, but reflects a deep, grounded wisdom. We need to return to the fundamentals that indigenous cultures have long maintained and protected. Just a quick reminder before we go further, please ask your questions in the Q&A box above the window. We will take your questions after the presentation. Paula, over to you now. Nature-based solutions bring global health and social benefits. Could you please share your expertise and lesson learned from case studies within IUCN? Over
Hi,
to
everyone.
you.
I hope you can all see my screen, and thank you so much for inviting me to be here. So I'll try to give a few examples of how nature-based solutions can really improve human health, specifically zoonotic and some vector-borne diseases. They are mostly from South America because I'm Brazilian, so most of my research was done in Brazil and in the Amazon. But also I'll talk a little bit about one example from Liberia. And I try to organize this talking about the types of nature-based solutions as IUCN put in their standards. I won't mention that they're in here, but we have the ecosystem protection approaches, it is mostly conservation measures. And in this study, for example, we were trying to understand the effects of indigenous land protection, which in this case is what is called other effective conservation measures, and their impacts on 5 different zoonotic and vector-borne disease. And I just want to bring some point that the Atlantic forest in Brazil is all this region, is almost 1/3 of the country. Normally people think that we just have the Amazon, but this forest is also tropical, is really important and is highly degraded. So it is one of the hotspots of biodiversity and also one of the hotspots of emerging infectious disease, according to the Allen 2017 map. As we can see in this map, this forest used to cover all this area that is in red in here, all in here, but now is only the parts in green. So we can see that it's highly degraded, and because of that, it is one of the regions in Brazil where we have most of the outbreaks of zoonotic and vector-borne disease occurring in the country. And I'll be very brief because we don't have much time, but what we saw during this study is that if we protect indigenous lands in this highly degraded biome, we can see a protective effect of the forest, of those indigenous territories in all the 5 diseases. In fact, we can see here that these purple circles, they are meaning that more indigenous land being protected, lower the incidence of those diseases. For Chagas disease, we didn't really see an effect, but overall, the picture is really good. It shows that when we protect indigenous lands, we can see a decrease in the incidence of those mostly of those 4 diseases, but also if you protect forests in general, we also can see a negative effect, a protective effect on those 5 diseases, with the exceptions of cutaneous leishmaniasis. So for this disease, we don't know the mechanism, but what we're seeing is that forests that are not protected can increase the risk, but if we are protecting these forests in indigenous lands management, this can decrease the risk for this disease. So this is pretty interesting. And then based on that, we decided to move from the Atlantic forest to the Amazon. And here we are trying to investigate the same question, how indigenous territories could affect the incidence of six diseases, 6 zoonotic and vector-borne diseases in the entire Amazon basin. And we also included some fire-related diseases. And we are looking at data for 20 years of diseases, and we decided to include fire-related diseases. I'll just talk briefly here, because I think everyone knows that when we burn a forest, it releases a very toxic haze that is full with toxic pollutants, and they can move kilometers away. So in here, for example, we can see a map from a massive fire that happened in the Amazon in 2019, and the crosses, they show the places that were in fire, and the purple pixels shows the high concentration. In this case, it was carbon monoxide that was in the air. So we can see that those pollutants, they can travel kilometers and kilometers and kilometers away. It is a transboundary effect. And when people breathe, it can make us sick. So in this study, we are really focused on PM 2.5, the particulate matter with a size smaller than 2.5 micrometers, because it is really small, and because it is really small, it can stay in the air for a long time, and because it's so small, when we breathe, it can enter our system, and it can impact our lungs, our heart, and we have several health diseases, several negative health outcomes that can appear because of that. A good thing is that forests, the leaves, they can absorb these pollutants. And then we have this service that we call air regulation services. So we are trying to understand what was the capacity of the Amazon forest and of those indigenous lands in absorb this PM 2.5 pollutant, and how these would mitigate those fire-related diseases. And we saw that those indigenous territories, they can absorb 25% of the entire capacity of the Amazon forest, which is huge because they don't cover 27% of the area of the Amazon. And if we keep those areas protected, this could in turn avoid 15 million cases of those fire-related diseases in 10 years and save $2 billion in health costs, because every time that a person gets ill because of this, normally they go to the hospital and they need to be treated. And at least in Brazil and in the Amazon, we have the free healthcare system, which is really good, the SUS, and then all the costs goes to the government. So here we are seeing that protecting those indigenous territories, they are not only mitigating those fire-related diseases, but they are also saving a huge amount of money to the government. So this is also a very interesting picture. So it also shows that when we are protecting those indigenous lands, we are mitigating zoonotic, those fire-related diseases. However, when we move to the zoonotic and vector-borne diseases, I'm not going to explain clearly this graph because you can see there is a lot happening. But in summary, what we can see is that the outcomes are highly dependent on the degradation that the municipality has where this indigenous land is implemented. So in summary, the outcome is it depends, and it depends on the context. So what you can say is that those indigenous lands, they can really protect or mitigate the incidence of those zoonotic and vector-borne disease if they are not inserted in a highly degraded municipality. If the context is already highly degraded, highly deforested, it means that I need more land being protected to be able to mitigate and to decrease the incidence of those zoonotic diseases. But think about the good part, this positive part of how those protected areas can really mitigate zoonotic diseases, we can include that in cost-benefit models, as Neil just mentioned, that we need to start looking at those economic benefits of those nature-based solutions for human health. And we did an exercise in a project in Liberia where we were trying to gazette 3 protected areas that are those 3 here, Sesto, Kwambasa, and Grand Cru. And we developed this cost-benefit model. I'm not going to explain in detail, but we had different scenarios. And the idea here was really to be conservative and to show what happens, how much of deforestation would be avoided if those areas would be protected, and how much cases of malaria would be avoided if we protect those areas. And then we were able to include those costs. And of course, we also included all the costs that those local communities would lose if this area is protected. So for example, all those livelihoods that are supported by those areas are not going to happen if the gazettement process happens. So we included this cost, but we also included other benefits that could happen. And one interesting thing to see here is that regardless the scenario, and we are really, really, really conservative, we show that when we include human health, the benefits really overcome the costs. So if we see in these small circles in here, in this graph, the benefits are the green color. So regardless of the scenario, if it's a 10 or 30 years timeline, or if it's a typical deforestation or very conservative deforestation where currently there are almost no deforestation happening in those areas, we also see that we always see that the benefits overcome the costs. So it means that when we include human health in the implementation, in the evaluation of the costs and benefits of those nature-based solutions, normally the benefits are always overcoming the costs. When we move to other types of nature-based solutions, which are the ecosystem restoration approaches, we have a very similar result, which is really interesting. So I'm going to start with hantavirus that was in the news recently. In Brazil is a very rare disease. It has a low number of cases, but a high mortality. And when we look at how the rodents that are the species that can transmit diseases, which are those 2 very cute here in Brazil, they are very generally. So it means that when we deforest native habitats, they can increase in abundance and end up dominating this landscape. So we did a study and we saw that when we deforest 90% of a landscape. So in here I have 10% of landscape, in here I have 30% of forest cover, and in here I have 60%. In the 10% forest cover landscape, the abundance of those species was 300% higher than in the 30% landscape. So it means that they are really, really, really benefiting from this new degraded habitat that we are creating. So thinking about that, we developed this model where we try to understand what would happen if we would increase the amount of forest cover of this region, and what would happen with the abundance of those 2 species. And in Brazil, we have a native vegetation law, which requires people to maintain 20% of their lands protected. However, no one really complies with this law. So in our model, we were really trying to create a model that is feasible. So we just restore this region until to reach the threshold of the law was respected. So nothing unfeasible. And then we saw that for both species, there is a huge decrease in the abundance in almost 50% of this entire biome, which is a huge area. And what I want to call your attention here is that for this species, that is the Oligorismus nigripis, we can see a reduction that can reach up to 98%. So the abundance of this species in some regions was almost 100 individuals. And after we restore, it ends up being almost 10. So it's a huge decrease. However, if you see those blue spots here in the map, it also shows that in some regions, we can see a small increase in the abundance of these species after restoration. And even so, even with the small increase, we still would be able to see a benefit because we would decrease the abundance in almost 50% of this region, and this would benefit almost 2.8 million people, decreasing the risks of hantavirus, which is very important. But also what is very interesting is that when we're trying to understand how those species they respond to this habitat loss, they are not really responding to how is the habitat spatial arranged after the loss. It's just the amount of loss. So I don't know if you can understand this, but for those species, it doesn't matter if I lose habitat. And at the end, I have a landscape that has what we call a land sparing approach, that is this in the left, or a land sharing approach, where I have a highly fragmented, the same amount of forest cover, but with a high connectivity and people living in the middle of those forest areas. So for those rodents, the only thing that matters is the amount of forest cover. And we saw that by increasing it, we would reduce the abundance. So this shows to us that if I'm doing a forest restoration approach, which I can do by increasing the size of a large fragment in that landscape, or by increasing connectivity, doesn't matter the way, I would always decrease the abundance of those rodent species. The only point like that is when I'm creating new forest areas where I don't have any forest areas. So I have a highly degraded 0% forest cover landscape, and then I start creating new forest areas, is when we increase the abundance of that species. So when we move to yellow fever virus, we see that the answers are, the outcomes are completely different. So for this disease, what is really important is the way those forest areas, they are arranged in the landscape. And we see that when I have a landscape that is highly fragmented, like this one in the right side, with a lot of forest corridors and small stepping stones, as we say, we can increase the risk of this disease. And we have what we say that is a land sparing approach, which is a large block of forests. This can decrease the risk because it can stop the movement of the mosquitoes. So this shows that when I have an intermediate amount of forest cover in these landscapes, what is really important is the way those forest fragments are going to be arranged. And then if I'm thinking in how to restore a forest areas, I really need to plan to make sure that I will have win-win benefits for both conservation and yellow fever risk. So considering, for example, hantavirus and yellow fever, if I want to have win-win benefits for both of them, I will need to not only increase the amount of forest cover, but also to make in a way that is not going to increase the connectivity of those forest areas, as in the one in the left side. So this shows that we really need to plan, and then sometimes we are going to have trade-offs between the different diseases. So what we are seeing when we include other diseases in those studies is that is going to be highly dependent on the disease being studied. So I'm never going to have what we say, what we call a high risk landscape for all diseases, or a healthy landscape for all diseases. I will always have a trade-off, and I need to understand when those trade-offs are going to occur. And because of that, and because we are seeing that normally when we have a low amount of forest cover, highly degraded context, or intermediated degraded context, I can increase the risks both when I am conserving or restoring forest areas. We are creating what we are calling guidelines on how to integrate zoonotic and vector-borne diseases into restoration planning, with the hopes that we are going to start looking and monitoring those risks to make sure that we are going to be able to mitigate them. And this is my last my last one. And what is really interesting is also when we move to urban areas, and here we are trying to understand the infection, the abundance of Lira for Aedes aegypti and dengue in the city of São Paulo. We also saw that when we have a higher number of isolated trees, we also have a higher infestation of Aedes aegypti. And this also shows that nature-based solutions, they have a huge potential to mitigate those vector-borne diseases, but they really need to be well planned. Otherwise, we can have unintended consequences. Thank you.
Thank you, Paula, for this excellent presentation and for showing how conservation and biodiversity protection deliver real benefits for human health in tropical areas and, by extension, worldwide. Turning to Serge now, you've worked in Southeast Asia for more than 20 years and led several restoration and prevention programs with a focus on eco-health. Could you share your experience and leading with ASAMCO Thailand, Laos? The floor is yours. Thanks.
Yes, thank you very much. So I just put thank you for the invitation, and thank you for the honor to speak after Neil. And we have very nice talk, and I think it's really helpful for me that really more on the bottom-up approach. Even I work also on the global, but it's really on the bottom-up approach, and especially presenting ASAMCO. Okay. Just to say that ASAMCO is part of the PREACTS in action in the global south, but is a part of this which is funded by the AFD, the French Agency for Development, and it was in three parts: Africa, ASAMCO, and ASICA. Actually, the work packages are the same as PREZODE, but for ASAMCO, we really focus on the work package 2, the co-design of solutions to reduce zoonotic risk. Alors, why we put ASAMCO? So it's ASAMCO is a regional approach in American and Caribbean region, African region, Southeast Asia, and Southeast Asia in Thailand and Laos. And I'm very happy that my co-PI is Dr. Sawapak, which is also the president of PREZODE International, very small family. And here is the partner on geography of intervention. We work recently, we decided to work at the border provinces, and we have the 2 Ministry of Health with all the One Health coordination unit for doing the top down, and we have the bottom up, which are mostly with the free NGOs and our colleague with IRD. So why Southeast Asia? Because actually Southeast Asia is, oh, I lost everything, sorry. It's okay, I'm back.
Yes,
Okay,
yes, we can
sorry.
see the presentation.
I don't know what happened. Huh? So, and it's really a real hotspot of biodiversity at threat and also of emerging diseases. That's why 20 years ago, I decided to go there because I work on biodiversity and especially health. But what we use for ASAMCO, we use the OLEP definition of upstream prevention of zoonotic spillover. OLEP is a One Health high-level expert panel, and which is a help and a panel to help the quadripartite for the One Health implementation. And what is the upstream prevention is to put the prevention much more upstream, really on the environment, the socio-ecosystem, really to tackle, to address the anthropogenetic drivers, to understand what's going on, and to really put in place the risk reduction activities and potentially an integrated surveillance. So before the spillover to go, because after we are really in the preparedness and response. So we have, I will not go more about this, but we have a lot of nature-based solution which involve effectively what already Neil already mentioned. We have the IUCN, thanks also for Paula, and you have also all of these activities that could be related, pastoralism, agroforestry, agroecology, urban greening. And we have a lot of NBS response options for zoonotic prevention. For example, when we work on the forest and trees and for human health in 2003, of course, what also Paula was leading with the IPBES interlinkage, and have the chance to be there, and also the dialogues of the forest for this. So in ASAMCO, we have 2 ways to investigate this nature-based solution. One on the pastoralism, or what I would say eco-health pastoralism, and the other one on the community forest. Eco-pastoralism, I will go very very fast with this. Really, the objective is really to assess the risk assessment, but really to demonstrate that on the eco-health pastoralisms, and is the effective solution to enhance biodiversity, we have some knowledge, and to decrease and manage better well the zoonotic disease transmission. So I will not go a little bit on this, but take my time, especially for a project, because we have another support also supporting for research on this, which is rewilding community forests and community forestation. And we work in the northern part of Thailand, where I used to work for almost 20 years, and with the national park, but also with all in red. What you can see here is all the community forests, sometimes registered or non-registered. And we have to know that in 2019, not far long, Thailand has already recognized the community forest as recognized. So there is a Thailand Community Forest Act managing, which means that the community, the local communities have the right to manage their commons. It's really commons. So of course, the same is to assess the contribution of community forest and reforestation through rewilding and to decrease, actually to have some supporting of what Paula just presented. So of course, at the first time, we're building an open database with a lot of information, what we get from land use, land cover. We develop a fire, of course, because the PM 2.5, but also the database on what the people can, the department can give us, the biodiversity from GB for IUCN, what we gather also in terms of iNaturalist. We engage with the public health surveillance system. That was also nice to have Dr. Sawapak to be involved. We can investigate the scrap typhus Thailand at the level of individuals for the last almost 17 years in Nan, in this place, and try what we could show that increases forested areas along the time really mitigate the risk of scrap typhus transmission. Scrap typhus is also a vector-borne and reservoir on zoonotic disease associated with rodents. We develop a full integrated protocol with drone, LiDAR, using a camera trap, sound recorders, bat sound recorders, trapping also individual, putting also, and thanks for one of my colleagues, and when we learn with him, putting collars on dogs, but we will do that with the cattle, and doing a lot of eDNA also investigation. You can see some of the animals we can find just in the community forest, close to the village, 300 meters from the village, from the community forest. And of course, we have to engage with the local communities and local administration, and that's what we did, and thanks for most now 14 years of working with the local communities and administration, what we name a social ecological and One Health observatories, One Health and biodiversity, when we develop the way to better formulate the problem, better co-develop the protocol, implement, of course, going to the ethics. I will just give you a little example: realization, analysis, recommendation, communication. And we develop a lot with the local people, but also with the local other stakeholders, like the rangers, like the public health, participatory mapping, all this kind of working all together, and also to work all together on the traditional, on ecology, on local ecological knowledge. When we compare with the scientific ecological knowledge, we can assess for each of the community forests how they work, how they rotate, how they manage also the fire break, how they oh, wow, I don't know what happened. Refuse all the time my presentation. I go back. I will arrive soon. And especially what was interesting, so all the communities have developed also their community forest rule. For example, if anyone disobeys the rules, they will be fined. So for the communities, they do not cut the trees, do not uncroach, do not hunt wildlife. Of course, they can go to the national park to hunt wildlife somewhere, but it's really commons in the sounds of Elinor Armstrong, which is quite impressive. And we work also with the children, but not children to teach the children, actually to understand what are their knowledge, what are their ecological knowledge that they gather with their parents, with their communities. And we work with 47 children. Actually, they can recognize 105 plants, and we developed 90 books. And these plants are for culinary, for cooking, or for traditional medicine. Of course, we have a problem. We will not share this information because first they are children, and first they are local traditional knowledge. So that's why I will use my 3 last slides. What is really important when we work, especially in community forests and in local nature-based solution with the local people. First, we have to understand really the governance, how the law, the law of Thailand, actually, the different law, the law for health, the laws for forestry, the law for national park, the law for urban, the law made also by the Ministry of Interior, all the law works in practice. So we need methodology like situational analysis, scoping review, and thematic analysis to better understand the law actually in the text and the law in practice. And second, we use what we name the soft law because we don't need new law. Actually, on the communities, they don't need new law. It's really to use actually the One Health approach as a way to improve their governance capacity. Why? Because adaptive law or soft law refer to the set of non-binding rules. It's adapt to solution. It's give behavior without creating constraints. Actually, the rules they are their rules. They can manage, they can evolve the rules of the communities. And adaptive laws include recommendation, guidelines, code of conduct, influencing practices. So it means in terms of governance capacity, we go to the powerless spectators. For example, mostly in France, I would say, to the adaptive managers. So by the managing of natural resources, by having a vision, a network, and because they work in the polycentric institutions, and they can manage this, they can provide with the policy, and they can enabling policy, their role, they could be really adaptive manager, especially using the One Health approach. But we have to be very careful of 2 things, the data governance. As a scientist, we think mostly about access of data. We use the FAIR principle. FAIR, findable, accessible, interoperable, reusable. But we need to include also the CARE principles. And the CARE principle shift the focus of data governance from the pure consultative approach, I want data, to the relationship. So based on values on collective data rights that indigenous communities claim. And with this, I will thank you for the time. Thank you.
Thank you very much, Serge, for your brilliant presentation and for sharing this work and encouraging results so clearly. I'll now hand the floor to Elsa, who will bring questions for the 3 of you. Thank you.
Thank you, Catherine, and thank you so much to Neil, Paula, and Serge for this presentation, this very excellent presentation. We have prepared a couple of questions. We also have some questions from the audience, so we will try to be like straight to the point. First, I had a question for you, Paula, but Neil and Serge, please feel free to also give your opinion. I want to discuss the IPBES Nexus report and how this report brought together the idea of the interaction between human health, between climate, between biodiversity changes.
So this Nexus assessment was the first one that really integrated human health and the links with biodiversity, water, food, and climate change, but not looking only human health as an outcome, but how all those 5 elements were interacting and having feedback loops and cause consequence. So at the end, what we have is a very interesting, I would say, like Serge was part of the chapter 5, so he can talk more about that. A very interesting action plan, if we can say like that, with several response options that are really integrating biodiversity, climate, water, food, and health. And that really shows that if we use one solution, thinking about only biodiversity, for example, it can also have positive effects for climate, food, water, and human health. And for human health specifically, we have 15 of those response options that also have positive outcomes for the other benefits. So I think it's really a very good roadmap and really useful information and really clear on how people can really integrate human health outcomes into biodiversity and climate action, for example. And I think, Serge, please complete because you are creating those responses.
Thank you. Nothing to add, just to re-emphasize that this was, for me, quite amazing work that has been done by the IPBES, and thank you for Paula for this. And for this chapter 5, what we were completely amazing. We did not expect to see the outcome that investing in One Health, in health solution, focusing on human health. Actually, all of these solutions, these response options, have never negative impact on the other members of the Nexus. Wow, go there. We can go there. It's a good way. And actually, it's follow what Niels already said at the very beginning of his introduction.
Thank you. Thank you very much. I have another question from us, but also from Mauro de Rosa. It kind of connects the two of them regarding the implementation of nature-based solution. So we know that One Health approaches often generates a strong return on investments, not easy, I would say, to demonstrate. And the different scenarios and studies that you presented, for example, on deforestation, these demonstrate the economic and social benefits of prevention. So it appears logic, and it should appear logic to everyone to reduce deforestation and try to fight climate change and reduce CO2 emission. But in practice, this does not happen, or not yet, or not enough, or sometimes not at the scale it should happen. So in your opinion, to the three of you, what are the main barriers to implementation? And how do the incentives misalign? So yeah, that's the maybe Neil, and then I'll be happy to hear.
Thanks. You know, for me, thinking at a macroscopic level, a major barrier to implementation is that a lot of decisions on how limited resources are used are made by people who do not understand the role of nature, right? So there are so many billionaires who decide how philanthropies spend their money, and these are people who made their money off of technologies. If you read, and I'm not trying to say anything negative about Bill Gates. He's one of the greatest humanitarians that has ever existed and has saved so many lives. But if you read his book on pandemics, you read his book on climate change, there's basically no mention at all of nature. And I guess it's not that surprising because he's made his fortune off of technology. But then you have other technological magnets and prodigies leading major government initiatives. And again, I'm coming from a US perspective. This might not be representative of the world, but we're seeing similar trends in other parts of the world as well. But again, there is such a movement away from technology into people who are making decisions about how limited resources are used. I think that we need more of a grassroots movement, engaging people's hearts and minds, people who are closer to nature, many indigenous peoples, other traditional communities. We have to go out of our comfort zones. Many of us are scientists. I am so amazed by what Serge and Paula are doing. Incredible research. And we also need to make sure that we're linking our work with the needs of communities, which both of them are already doing, many of the people on the call are doing. But we can't rely on people at the very top to move forward on these nature-based solutions. Over.
Thank you, Neil. Paula and Serge, do you want to say a word regarding the difficulties?
Before to top on with Neil, I completely agree with you. I say we say the problem, most of the problem is at the level of the government. The government, for many reasons, they don't want to work very much on this, or they have some other priorities. But we see a lot of movement at the local level. I would say the municipalities, the cities, even the US, in many countries, some other small districts, they are engaged in this. So there are politics, there are somewhere that are, and I think we should also put them really in light, showing, for example, we see that in the One Health Summit, I think the best thing, it's only one best thing that was there at the One Health Summit in Lyon, when there will be the alliance of the cities in North and South to put the One Health for the cities, but not by the cities of the North want to teach the cities of the South. They want also to learn from the cities of the South, especially because of the changing climate change, invasive of vectors on how the cities. So this, I think we should also really support the local administration and the local politicians that are also really engaged in these values.
I just want to add that the IPBES transformative change did a very good job in trying to understand those underlying causes of why we are not protecting nature, and it goes beyond the indirect and direct drivers, as we always say normally. And then what they say is that we are growing up disconnected from nature. So we don't have this strong connection that we used to have in the past, and then we don't see the important role of nature in our daily lives. And this is one of the main problems, just to complement what Neil and Serge already said, that I think is very interesting. If you're interested in that, I would read the transformative change, because it really shows this philosophic point of view of why we are not really interested in changing the way we are doing things.
Thank you all. So Mao was talking of the benefits captured by private actors and the lobbying and influence from affected industries, and it brings me to another questions. Dee van der Koff is asking, where are we in terms of accountability? So, for example, fossil fuel companies who know about the long-term effect of their activities and past, previous and current activities, but still decide to go for profits and still make a lot of it. So what do you think, how we can, make them accountable for their actions, and how can we involve these companies into changing, behavior, changing mindset? That's not an easy one.
well, no, I don't think there is much accountability, right? People in these extreme positions of power, again, getting back to what Paula was saying about the IPBES report, one of the underlying causes they identify is the concentration of wealth and power. And we're seeing that happen more and more, which is a big problem. But at the same time, people are also realizing that our dependence on fossil fuels is absurd. This war in Iran, which has caused so much suffering that the United States started, is actually a wake-up call that we are dependent on fossil fuels, and it can bring down the whole global economy. We need to have more investments in renewable energies so that people have more control over the energy that they need to live better lives.
Thank you, Neil. And I have another question. So this one is for you, Paula, from Daniel Dornan, regarding habitat fragmentation. So does this fragmentation alter antivirus risk by modifying host locomotion, contact rates, and environmental persistence of the virus? So for example, in Madagascar, rats exhibit higher infection probabilities in fragmented habitats compared to continuous forest. Is this something that you observed?
Yeah, so it is the same, and our hypothesis and studies have shown that we have several mechanisms involved. So the first one is that when we are losing and fragmenting habitat, we end up selecting just a few species of rodents that can thrive in those environments. And in Brazil are those two that are highly capable of transmitting hantavirus. So we have a low competition for resources. They end up increasing their abundance and consequently the contact rates, and then consequently the prevalence. And also we have more people exposing themselves and having risky behaviors in those fragmented landscapes. So we also have a higher chance of contact between people and rodents. And we also, we never tested, but we also hypothesized that the microclimate conditions in fragmented habitats also alter the environmental persistence of the virus, and also the this word is very difficult, aerolization, the airborne phase of the virus, and then it can also trigger and increase the risks. So several mechanisms involved, and very similar to what we're seeing in Madagascar.
Thank you very much, Paula. So unfortunately, this webinar is coming to an end. I'm sorry if some questions, well, we couldn't address all the questions, but feel free to be in touch if you want to carry on the discussion. Thank you to our wonderful speakers for the presentation and these very fruitful exchanges. Thank you all the participants for joining us today.